Hi guys, today we're here to do a selective functional movement assessment test with my good friend Jessica. This test is a way for physical therapists to look at gross movement so we can eventually break it down and help you move better so that you can feel better. We're gonna have Jess go ahead and face to her left. I'm gonna step out so you guys can see her. With all of our screens, we wanna make sure we have Jessica set up in a great way. We want her feet together and we definitely want her barefoot. Our first test, Jess, and she's gonna let us know also if she has any pain. I want you to bring your chin down to your chest. Good. What we're looking for is that there's no space between her chin and her chest and that she's not experiencing any pain. Great. All right, test number 2, we'll have you stay right there, Jess. I want you to look up as far as you can towards the ceiling. Good. On this test, go ahead and try that again. We want to see her get to about 80 or 90 degrees in her neck, meaning that her face is almost flat when she gets to the top, and a nice C curve through the back of her neck. Great. Jess, let's have you turn and face forward. Feet together and touching. Now, Jess, let's have you turn just your head as far as you can towards your right. Good. We're looking to see her chin get to her clavicle, the midline or the center of her collarbone. Let's have you go the other way and back to the middle. Let's have you do that again from the side. All right, Jess, let's go left first. All right, and we're looking for her chin to sit right over her collarbone and back to the middle. All right, and then same thing to the right. Looking for that chin to center over that collarbone. All right, go ahead and back to the middle, Jess. With all those patterns, we want to make sure they're pain-free, and we're also looking at symmetry. We want to see that the right side is completely equal to the left side. All right, let's go into some upper body patterns. Jess, let's have you turn all the way around so you're facing backwards. Again, feet together and touching. Let's have you take your right hand, reach behind your head, and touch your opposite shoulder blade. Good. We're looking to see that her hand touches that bony prominence, the boniest part on the back of the shoulder blade. Go ahead and come back down, and then same thing on the left side. Good. We can see that she has a slight symmetry difference. She can reach a little farther with that left side. Go ahead and come back down. You can stay in that same position. Let's take the right arm, and I'm gonna have you reach it up behind your back, touching the bottom of your shoulder blade. And back down. And we're gonna watch that one a few times because as Jess does it, we're gonna watch her right shoulder blade. We don't wanna see the shoulder blade rotating forward. We wanna see it stay nice and still, which you can tell she's having a little bit of trouble with. All right, let's try the left side, Jess. Same thing, touch the right shoulder blade and back down. All right, go ahead and give that a few more repetitions. Same thing, we can see she kind of picks up that left side a little bit to clear that shoulder. Good. All right, Jess, let's have you turn all the way around to the front. We're gonna go into our trunk patterns now. So feet together and touching. Our first pattern, we're gonna have Jess keeping her knees straight. We'll have you try and touch your toes without bending your knees. Good, and back up. We're looking for the fingertips to touch the ground. Go ahead and try that again, which she can easily do. But let's have her turn to her left. That's funny. And we're gonna watch that pattern again. Just go ahead, touch your toes if you can, keep those knees straight. We're looking to see her hips get behind her heels. Keep going there, Jess. And we're looking to see a nice C curve through her spine. So Jess has just a little bit of trouble with that. We don't have a totally uniform C curve quite yet, all right? Let's have you turn and face back to the front. Our next pattern is gonna be an extension pattern. So we're gonna have her, Jess, raise her arms above her head. Now, let's actually have you turn to the left again. When you're running someone through this test, if they can't get their arms overhead, it's actually an automatic fail. Jess does pretty dang well. We wanna see those hands centered right over the top of the shoulders. From here, we're gonna have Jess bend backwards as far as she can. Go for it, Jess. Good, and come back up. Go ahead and try a few more reps there. With this test, we want to see the front of her hips clear over her toes, past her toes, and we want to see her shoulder blades past the back of her heels. Good. We also want to see a nice C curve in the back. Try a couple more there, Jess. Which she has a little bit of a hinge, but she has lots of motion. All right, go ahead and bring those arms back down. All right, we're gonna go into a rotational test now. Jess, let's have you turn and face opposite the camera. Again, feet together and touching. All right, let's have you moving everything but your feet, and we want you to keep your knees locked out. Turn as far as you can over that right shoulder. Good, and then come back. Let's try that a few times. We want to see her whole body moving together uniform, and we want to see that left shoulder as she turns around. We want to see that left shoulder clear her body, which we can see. Go ahead and try a few more reps, Jess. But Jess gets a lot of extension in her back, meaning a lot of sway back or back bending. So she does have a movement compensation with that one. All right, Jess, let's try the other direction. Going to the left, go ahead and turn and back. And turn, and we can see she clears that right shoulder, but just barely. We're not totally uniform, and there we'd mark her as having an asymmetry. Good. All right, Jess, let's have you turn all the way around. Now we're gonna go into a balance test. So let's have you stand shoulder width apart, comfortable. Starting with your right leg. Let's have you lift your leg so your knee is at the height of your hip. And we're gonna have her balance here for 10 seconds. During this test, we can see a little bit of foot wiggle. That's called an ankle strategy. It's a really good strategy to see. We don't want to see her standing hip drop. We don't want to see her tilting side to side. We want to see her shoulders stay nice and even. And she's doing a nice job with this one. All right, let's have you go ahead and switch. Try the other side. Good. Same thing. Want that hip to stay up. She's just using that foot to help her balance a little bit, but we don't see any big movement. Good, go ahead and bring that back down, Jess. All right, for our last test, we're gonna run Jess through a deep squat. Let's have you do it to the camera facing first. So we're gonna have her set up so her second toe is straight forward on both feet. We're really picky with this one, about shoulder width apart. We're gonna have her bring her arms in front, and her cue is reach forward as you sit back and down as close as you can to the floor. So you wanna bring your butt down to the ground. Good, and back up. Keep going, give us a few reps there, Jess. What we're looking for here is that her feet stay straight forward. We're not seeing any turnout through the foot. We're not seeing any dropping in or kind of a kissing of the knees. Try a few more reps. Good, she does a pretty good job. I see a little bit of turnout on that right foot, but overall, pretty good. All right, Jess, let's have you turn and face to the left. Same setup, we're gonna watch her from the side this time. Same thing, we're gonna have her reach forward, sit back, and back up. And we really wanna make sure she resets between each rep, so we have uniformity in our testing. Good, and back down. You can see Jess clears her hips below her knees, which is a trademark of this one. Her back stays pretty nice and uniform. She's got a little bit of pelvic rotation, as you see when she comes up and down. You can see that low back position changes, but we don't get too picky about that. And back up. Great. Oopsies. Well, Jess, thank you so much for letting me run you through the SFMA. This is Kelly Brouwer reminding you to move well and live well.